Assalamu alaikum everyone. I am Dr. Samira Afroz, Associate Professor of Microbiology, welcoming you all to today's new video. As you are seeing on the screen, today I am going to talk about a very common parasite called Trichomonas vaginalis. Trichomonas vaginalis is actually a unicellular protozoa, and according to classification of protozoa, it's a flagellate. It resides usually in our urogenital tract, so it is also known as urogenital flagellate. Trichomonas vaginalis is called one of the most common parasitic cause of sexually transmitted disease and urethritis. So in this video, I will try to discuss about this parasite and parasitic infection in brief, focusing on the outlines, especially its important properties, morphological form, infective form, mode of transmission, what are the disease caused by this parasite, how this disease manifestation occurs, important investigations to confirm this parasitic infection, and treatment outline. So let's start. Trichomonas actually have three species: Trichomonas vaginalis, which usually resides in the urogenital tract, Trichomonas hominis, which resides in the large intestine, and Trichomonas tenax, which resides in our mouth and gum. Among these three, only the Trichomonas vaginalis is regarded as pathogenic parasite. The other two are usually non-pathogenic. As I said earlier, that they are urogenital flagellate, so they remain in the urogenital tract of both male and female. In case of female, they remain in vagina and urethra, and in case of male, they remain in prostate, seminal vesicle, or urethra. So when a female is infected by this Trichomonas vaginalis, the female develop vaginitis or urethritis, and in case of male, most of the male remain asymptomatic, but if they become symptomatic, they can present as a case of prostatitis or urethritis. So all these manifestations are collectively known as trichomoniasis. So we can say that infection caused by Trichomonas vaginalis is trichomoniasis. We should discuss about this trichomoniasis in the latter part of this video again. Now come to the morphological form. Trichomonas vaginalis have only one morphological form, and that is trophozoite. If you see the picture carefully, you can see the trophozoite form is pear-shaped. It has a single nucleus with a central karyosome and a long exostyle. It also possesses 4 flagella, and as we know, the flagella are the organ of locomotion. So this trophozoite is also motile, and it has a characteristic jerky movement. And we diagnose this trophozoite in the clinical laboratory in the sample through this jerky movement. So how this jerky movement look like? Let's see a video. This is a sample of high vaginal swab, wet mount preparation. We are seeing under microscope, and we are seeing the motile trophozoite, and they have a characteristic unique movement, that is jerky movement. So high vaginal swab, motile trophozoite with jerky movement. So our diagnosis is Trichomonas vaginalis. Now trichomoniasis infection. What is the mode of transmission? As I said earlier, it is a sexually transmitted disease, so it is transmitted through sexual route, so sexual intercourse. And in case of male and female, most of the male remain asymptomatic and females serve as reservoir. In case of female, the trichomoniasis more occur when the vaginal pH is altered. As we know that in case of female, the vaginal pH is less than 4.5. So how trichomoniasis occurs or pathogenesis of trichomoniasis occurs, before knowing that, we have to know how the normal vaginal environment is maintained. In case of female, there are 2 important factors which maintain the vagina healthy. Number 1 is acidic pH of the vagina, and number 2 is normal flora. Usually vaginal pH is less than 4.5, and how it is maintained? The vaginal epithelium is composed of or rich in glycogen, and this glycogen is converted by the vaginal flora into lactic acid, and this lactic acid continuously maintain the pH acidic in the vagina. So, this acidic pH and the normal flora combinedly maintain the vagina healthy and prevent infection or reinfection. But what happens in case of trichomoniasis? When a female patient is infected by the infective form trophozoite, it infects the squamous epithelium. Then it starts to release some enzymes, for example, cysteine, proteinase, adhesin, etc. This disrupts the glycogen. So, their acidic environment become altered and the trophozoites multiply. When the trophozoites begin to multiply, there is a characteristic changes occur in the vagina. There is punctate hemorrhage, as you are seeing on the screen. There is mucosal capillary dilatation, which gives a characteristic appearance called strawberry appearance, or it is called as a strawberry vagina, which is followed by metaplastic changes, desquamation of the vaginal epithelium into cellular edema and resulting in trichomoniasis. Now, a trichomoniasis patient, especially in female, what would be her common presentation? In case of trichomoniasis in female, the most common presentation is vaginal discharge. The patient will complain about profuse, thin, watery, greenish, foul-smelling vaginal discharge. At the same time, on a spirochronom examination, the strawberry vagina is the characteristic findings. In chronic case, in case of female, they can complain also about pruritus, dyspareunia, or even scanty vaginal discharge. In case of male, most of the cases males remain asymptomatic, but if they become symptomatic, they can present or they can come as a case of prostatitis or cystitis, epididymitis. Now, how we will diagnose this parasitic infection in the laboratory? First of all, we have to take sample. In case of female, we will go for high vaginal swab and urethral discharge, and in case of male, we will go for prostatic secretion or urethral discharge or even urine sediment. After taking the sample, we have many options for diagnosis of this parasitic infection. We can go for microscopic examination, we can go for culture, we can go for serological test and molecular method. But among them, microscopic examination is the most commonly used method. And among the microscopic examination methods, the wet mount preparation is the most commonly used one. Here, the sample is taken and examined under microscope within 1 hour. Why? Because in the sample, the trophozoites cannot survive more than 1 hour. So, after taking the sample for wet mount preparation microscopic examination, we will examine this sample within 1 hour. We will try at best. And what will we see? We will see the characteristic jerky movement of the trophozoite. Other than that, we can do permanent stain by Giemsa stain. We can do direct fluorescent antibody stain. Other than microscopy, we can go for culture, and it is done on Diamond's media. We can go for a very simple test that is called positive whiff test. What is that? Here, sample is taken from female patient, for example, high vaginal swab, and we have to add just 1 drop of 10% potassium hydroxide on the sample. So, there is production of amine and there is foul smelling fishy odor. So, result is positive, and if this test is positive more than 75% of the cases. We can go for serological test, and antigen detection can be done by using ICT or ELISA, and we can also go for molecular method, that is PCR. So, how can we treat this patient? Giving treatment of this parasitic infection, we have to remember 2 important things. Number 1, if the infected patient have partner, we should go for treatment for both partners simultaneously. Number 1. Why? Because we have to remember about the asymptomatic male, or we have to remember to avoid reinfection. And number 2, the drug of choice is metronidazole or tinidazole. So, this is all about Trichomonas vaginalis and trichomoniasis.